Welcome back to the Morning Blend. Spider veins can be seen through the skin and can cause uncomfortable feelings in the legs, and frankly, they're not pretty to look at either. Dr. Deborah Manjoney and Lisa Thomas are here with the Wisconsin Vein Center MediSpa with some old and new ways to get rid of spider veins. Good morning, ladies.
Good morning.
Thanks for being here. And I think it's worth pointing out that this is a good time of year if you have this problem to start thinking about it, right?
It really is, because treatment of spider veins is actually a process. And so after one treatment, we like to wait 4 to 6 months, then do another treatment. It may take 2 to 3 treatments to get rid of the spider veins completely. But it's a great time to start.
Yes, before spring and summer get here. We've talked many times on the show about varicose veins.
Yes.
Today our focus is more on spider veins. Do you classify these as more a cosmetic problem?
They usually are more of a cosmetic problem, but they may be indicative of something else going on. So depending on where the spider veins are located, there are kind of some clues to us that they may be related to an underlying problem with the veins, like venous insufficiency, a larger vein that may have a problem with the valves. And also, spider veins can cause discomfort.
Yeah, I would think. A lot of women get them, right? It's quite common.
Yes, it is.
About 70% of women throughout their lifetime will develop, some sort of spider vein issue.
So 7 out of 10 women at some point in their life will develop spider veins, usually in the legs?
Typically, yeah.
Okay, and what's the reason for that? I think a lot of people associate it with pregnancy.
It can be a cause from pregnancy, usually after having several children, genetics or hereditary, so parents or grandparents have had it, trauma to an area.
Okay.
Venous insufficiency, like she mentioned, as well as maybe being overweight.
And men can get them as well?
Men can get them as well, yes.
Okay, not as common probably in men?
It's not as common in men. We see a lot of men who get them when they've been hit by a ball or something earlier in life, and they have a bruise that then, as it heals, they're left with spider veins.
Why does that happen?
Really don't know why it happens. It's just that you're breaking some vessels underneath the skin, and when that happens, you can have other little tiny vessels in the fat and in the soft tissue suddenly become much more apparent.
Okay. You mentioned that they can be painful. Is that a sign that maybe there's an underlying condition or another problem?
It could be. We always look for something else when somebody comes in complaining of discomfort at a spider vein area, but it does not always mean there is another problem going on underneath.
Okay. What about types of treatments? Because we mentioned when we were introducing you that there are some old treatments that are probably very successful, but also some new things that you can do as well.
True. Well, sclerotherapy is the gold standard. And sclerotherapy means injecting an irritant into the vein to get the vein to go into spasm and close down. And we always use sclerotherapy, as Lisa's doing in this video here. And we use 2 different detergents that are FDA approved for that. So they're much less painful than the old-fashioned method that was used many years ago, where they used what we call hypertonic saline, or a salt solution that was very caustic and uncomfortable. But beyond that, we also use a laser on the surface of the skin to help injure the vein from the outside. It's attracted to the pigment in the blood vessel, as we're seeing here. And then we also can use a little radio frequency needle, or a hot needle, almost like an electrolysis needle.
Now, is this painful, the laser part of it?
It feels like a hot needle, I would say. And we like to use some cooling.
Yeah, we use a coolant, so it's very tolerable. And typically our treatments are 10 to 20 minutes. We usually treat an area, sometimes just a leg at a time.
And you mentioned that it's a process. Is there downtime, and what about the support hose that a lot of people wear with this procedure?
We do place our support hose before you even leave the office. We ask that you walk around, and we actually would like you to be active. So really there's not a lot of downtime. If you're really strenuous, you like to exercise, we ask that you don't do really strenuous activity for about 24 48 hours, but really there's no downtime at all.
And we've actually seen some rather fashionable support hose here on this show. I mean, they used to be just like the nude, or black, but there are other colors, and there are easy ways to wear them, and I think this is a great time if you need to wear them before summer gets here.
Oh, I think so, absolutely. People don't like having these types of procedures done during the summer if they have to wear a darker stocking, or they don't have their bare legs ready to expose, but this is perfect. So you can wear your bare legs without feeling embarrassed and without having the discomfort of the spider veins by summer.
Yeah, we have 2 before and after pictures that kind of illustrate the look of these veins before and after, and I would think that people, along with maybe getting rid of some of the discomfort and pain, are just really thrilled with how it looks, just in terms of a superficial, it just looks so much better, and they feel better about themselves.
They certainly do. And people come in and they say, I can't believe it, I wore shorts this summer, or I wore a skirt for the first time in years. So it's nice. And it also is a very nice way to finish up if we are treating varicose veins, and somebody has spider veins as well. then it's just one more step in getting those legs to look the way somebody wants them to.
Quickly, does insurance cover spider vein
No.
treatment?
Spider vein treatment is never covered by insurance unless somebody's been having hemorrhaging from the area, bleeding from what we call little hypertensive spiders that can break open. That's very rare.
Varicose, though,
Varicose
insurance
veins are
pays.
almost always covered by the insurance company if somebody's symptomatic or they have any problems associated with them.
Okay, nice to have both of you here. Thank you so much. It's worth being evaluated if you're having pain or discomfort. Notice spider veins, especially because it might be the sign of something more serious. You can contact the Wisconsin Vein Center and MediSpa. They're located in Pewaukee. The phone number for an appointment consultation is 262-746-9088, or you can go to wimedispa.com. Again, thanks.
Thank you.